That's the big story in the country right now, and that is the subject of this evening's Talking Points memo. First of all, President Obama's intentions are good. He wants to clean up the health care mess. That's hurting millions of Americans. What's wrong with that? Nothing wrong with that. But his plan is chaotic and the expense ill-defined. But the president sees great urgency.
This debate is not a game for these Americans, and they can't afford to wait any longer for reform. They're counting on us to get this done. They're looking to us for leadership, and we can't let them down. We will pass reform that lowers cost, promotes choice, and provides coverage that every American can count on. And we will do it this year.
Probably not. Democratic Senator Dick Durbin saying today it'll be fall before any meaningful debate takes place in the Senate. Tonight, the president faced a rather docile press corps and buried them with rhetoric.
You may not see it because if you have health insurance right now, it's just being sent to the insurance company. But that's raising your premiums. It's raising everybody's premiums. And that money, one way or another, is coming out of your pocket. Although we are also subsidizing some of that because there are tax breaks for health care.
I think my head is going to explode. I don't know what he said. Now, I'm not being a wise guy. I've often said the government needs to control the medical industry, a lot of oversight. But after another hour of Barack Obama explaining his program, I still don't know what it is. The man is incapable of breaking it down so that we, the people, can understand it. That's the crux of the matter. It's supplemental. It's elemental. It's whatever mental you want it to be. It's crazy. If President Obama wants Americans to support an overhaul of the health care system, he's got to put it in bullet form. Like, remember Ross Perot? He's got to get the chart. So we know what's going to happen and who's going to pay for it. Otherwise, this is not going to fly. And that's a memo. Now, for the top story tonight, is the president losing the support of the folks because of the health care fog? And why was the press so passive? Joining us now from Washington, A.B. Stoddard, associate editor of The Hill, and Sam Youngman, another Hill correspondent who was at the press conference. Sam, as you're standing there, I'm going to go to you first, and I usually go to ladies first, but Sam, what is with the press? I mean, they're asking these long, detailed questions, serving it up for him so he can just give a lecture. And look, maybe I'm a dumb guy, but I do this for a living. I don't know what the plan is. Do you?
Well, I think the questions might be detailed, but the answers certainly aren't. We're hearing the same thing from this president we've heard every day since he got back from overseas.
But Sam, let me stop you. Do you, Sam Youngman, a trained correspondent sitting there after listening to the president for an hour, watching him, do you know what he said? Do you know what the program is?
Well, I'm going to try and make some sense of it after I get done here talking to you here. But I think what the president continues to say is we don't know what the details are.
You just answered the question. You sat there, and now you have to go home and try to make some sense of it. That's not the way you do it, Ms. Stoddard. That's not winning hearts and minds. People just gave an hour of their lives to sit there and watch President Obama go all over the place, say a million things, but I still don't know what he's going to do. Ms. Stoddard.
I agree with you, Bill. Although he makes a good case for his general principles and how he wants health care reform to fit into the larger context of fixing the economy. But what he doesn't like to do is talk about how he'll pay for it. He wants Congress to figure this out. What I thought he was going to do tonight was get up and embrace a pay for, an actual specific payment plan to offset the costs of a reform plan and tell Democrats directly in the Congress, this is what I think is the best fix. You're with me or you're against me. Show some leadership and really kind of come to the table as he's been promising to do for months. He made a reference to the fact that he still thinks his payment is the best, which is to limit the deductions on the wealthy, and that has appeared in some bills early, but is no longer in any of the bills under consideration. So he did not actually back a specific plan.
Right, that's what I'm trying to say.
Tonight, and he didn't tell them what to get to.
Look, his poll numbers are cratering. All right. After this, I predict tomorrow it was 55%. Mr. Youngman, this week's Gallup poll doesn't like the way he's handling health care. Tomorrow it goes to 60. And who can blame the folks? The folks are sitting there. They want health care reform. They want to feel secure in this area. And they don't know what the hell the president is saying. I don't know what he's saying. You have to go home and digest it And AB says exactly what I'm saying. He's all over the place. So I'm saying it goes to 60, and now, unless you're a zealot in the House and Senate, you've got to question whether this thing can fly ever. Mr. Young.
Well, clearly the president, I mean, they were hoping, I guess, tonight's audience hadn't been paying attention to the same things he's been saying for the last 10 days because there was just nothing new here.
All right.
I think this is a president who's trying to regain message footing, and I don't know if he did enough tonight to do that.
Key question of the night, AB. The president is going to lose massive amount of credibility in this whole deal unless he pulls the proverbial rabbit out of the hat. People are starting to lose confidence in his leadership because this is his signature issue. Okay? How bad is it right now, as we talk about it right now, for Mr. Obama?
I think it's bad because it doesn't look like he is going to get this over the finish line before the August recess. He did not give members of Congress the big fight. It looks like it's bleeding into the fall. He said, we're going to have it this year. That's what he said definitively. This year, once you get into September, as you know, Bill, and they try to pass the appropriations bills and get very much closer to the holidays and an election year, it becomes much harder to pass health care reform. And I think if he doesn't pass it, it's a big problem for the rest of his presidency.
All right. Well, we appreciate it, guys. Thank you very much. Again, I just want everybody to know I have no partisan dog in this hunt. I want everybody to know that. All right? I'm not coming at this like Obama's some socialist nitwit. That's not what I do here. Okay? I am wanting to understand how President Obama is going to improve your life and my life in the health care, the vital health care realm. I want to understand. I have a master's degree from Harvard University that cost me $30,000 to get. I do not understand what the man is saying.